Hello, welcome to another Dr. Foot video. It's at the end of a very busy day. I've treated quite a few patients today actually and done quite a lot of injections. I thought I'd take this opportunity to make a short video about my top 3 tips to take care of your feet and your lower limb during these winter months. Tip number 1, very straightforward and something that's quite overlooked. Take care of your skin on your feet and your ankles. During these winter months, your skin may get very dry, so use a moisturizing cream. At a basic level, I really like Palmer's cocoa butter. I think it's great, so you could try that. If you want something a bit more powerful, maybe use Flexitor, which is also very good. CCS foot cream, brilliant. I also like a German product called Gearwall. You can also use that. So that'll help to prevent any problems, any cracking of your skin. Tip number 2, wear appropriate footwear. It's so important. During these winter months, obviously you have to wear shoes that are supportive. There may be frost, ice, snow on the ground. Wear a shoe that is going to give you support. Make sure the sole of the shoe has got a firm support on there and it will give you grip. I'm not a fan of Ugg boots. I don't think they are very supportive and I just don't think they're very flattering personally. But if you are going to wear them, be careful, okay? So I'm not going to go on a mission against Ugg boots. Fine, wear them. Just be careful. Understand that they don't give you a lot of support. Don't go walking in them for long periods of time. Treat them like flip-flops. You wouldn't go and walk in flip-flops for 10 miles, would you? I hope you wouldn't, but yeah, you wouldn't. So yeah, wear supportive shoes. Make sure you're wearing shoes that are appropriate for you. If you're taking part in sport, make sure the shoes have enough grip if you're running on pavements that are icy and slippery. Ladies, if you're going out in the evenings and you're wearing high heels, be careful. You do not want to sprain your ankle, because if you sprain your ankle, you're going to damage your ligaments on the outside of your ankle, get a swollen foot, then you'll come to a podiatrist or a physio or a doctor, and then we'll have to take care of you. But you really should be coming to a podiatrist and nobody else, because if you've got foot pain, but that's another video for a different day. Number 3, my top tip, my 3rd tip, and I think this is one I want everybody to do, and that is take vitamin D supplementation. So important. During these winter months, we don't get enough sun. Now, the primary source of vitamin D is from the sun. There's been some studies that have suggested that a vitamin D deficiency can lead to joint pain, muscle pain, bone soreness and aching. It can also lead to heightened sensitization, so you could get a higher sensation of pain. Also, it affects your mood swings, so you can get low mood swings. I can't really blame that for my grumpiness. I'm always grumpy and I don't think I've got a lack of vitamin D. But yeah, it can affect your mood swings. It can affect your psychological state, so it can be one of the factors that can lead to depression. I'm very hesitant to say that because I don't really know, but from the few studies that I have read that it can affect your mood severely. Now, I know from somebody who treats a lot of athletes, if you are pushing your body, and if you're in the gym or you're running or you're doing bodybuilding, I've got decathletes on my books and I've got high jumpers. If you're doing an exercise that is really pushing the bounds of your body and you're pushing yourself week on week, you need to take vitamin D supplementation, as we're not getting enough sun. We are not getting enough sun, and it will help you with your recovery. It's so important. But I think, even if you're not an athlete, I think it's great to take vitamin D supplementation. I recently had a patient who had Achilles pain, both feet, and there's something not right with this patient. So I sent off for a blood test and I found that vitamin D levels were ridiculously low, like 7 or 8. And I think it may have been one of the contributing factors may not be the reason why, but the heightened sensitivity to pain may be because of a lack of vitamin D. So those are my top 3 tips for everybody during these winter months. Taking care of your skin, wearing appropriate shoes, and vitamin D supplementation. Let me finish off my coffee. I have 1 patient left and I can go home. I need to go. I'm so tired. And I shall speak to you soon, and thank you for listening. Goodbye.